Hey, Rob. So I'm super excited today for our episode with Beneva. We've got Sunil joining us today. We're going to get it all, I think. We're going to hear about the small bit to mid-sized market. We're going to get all angles of what he has to share from us because he's done it all. This guy's been around the block.
Yeah, exactly. Well, 22 years in the industry for Sunil and with multiple carriers and starting from, and he'll talk a bit about stuffing envelopes back in the day with insurers to now how companies are trying to modernize their benefit programs and what he's seeing in the small and mid-sized market that I think is really going to be advantageous if you're a decision maker for benefit programs in Canada. So yeah, we're looking forward to having him today.
Yeah, I think the pulse of the small to mid-sized market is going to be evident in this episode. So can't wait for our listeners to hear it.
With that, let's bring in Sunil.
I am really excited to welcome our guest today, Sunil Hirjee from Beneva. Welcome.
Thank you. I'm excited to be here.
Yeah. So, Sunil, you are the VP of Sales and Partner Experience with Beneva. So tell us a little bit about your background.
Yeah. So I've had the pleasure of, do you want me to start from the very beginning, like July 1979? Or so I'll kind of give a bit of a professional background. So as I was at U of T, I decided, you know, I need to pay for school instead of taking these loans from our provincial government. So I took a job with Canada Life at the time, and it was actually through a temp agency. But I got the opportunity from there to actually join the organization, and I did a bunch of operational roles from group administration and billing. I even stuffed envelopes with drug cards at one point and mailed them out. I may have called in sick a couple times for that job.
That is old school.
And then I moved into like that universal call center. So answering the questions from members, plan sponsors, even providers about what type of coverage existed, what happened with claims, before I eventually joined the account management teams at an insurance company. And I joined as a service rep where, you know, we're frontline, we're helping administrators and plan sponsors understand how to administer the programs and helping educate plan members on what's being offered through their private sponsored plan. Before ultimately I switched into a sales role to go out, bring in the new business, make sure that we're managing that business that we had on the books effectively. And then about 10 years ago, I transitioned into leadership roles with a few organizations now, where I was leading these sales organizations. And like you said, I'm now serving as the VP for the Group Sales and Partner Experience team at Beneva for the Ontario Western and Atlantic region. And just to be clear, Beneva, we're not new. It might be a new name for a few people, but it's the coming together of two legacy, strong founded insurance companies, La Capitale and SSQ. And we came together, we rebranded, and we are now known as Beneva. So that's the professional side. But just very quickly, on a personal note, I am a first-generation immigrant. So my parents came to Canada. My mom, we grew up in a very small town called Paris, Ontario. And my mom was working for a small employer in the town. My dad was self-employed. And at a very young age, my mom got diagnosed with a chronic condition. She was diagnosed with breast cancer, and she's a thriver. She lives 7 kilometers away from me now, and I call her every day at about 12:30. But I saw very clearly at the age of like 13, 14, the impact a chronic condition could have financially on a household. We didn't have private insurance. Her employer at the time didn't have a program. My father being self-employed, we didn't have anything. So I saw that impact, and I also saw the lack of awareness. Partially, I'm put some of that accountability on my parents. They had been here for 15 years, but they really didn't understand the universal social assistance programs available to them when they were dealing with that situation. So because of that background, I kind of have this different perspective and a very clear understanding that there's a big value to what we get in the group benefit space from our employers and our plan sponsors. And that passion, I think, is part of what makes me want to keep doing what I'm doing.
That's amazing. Yeah. There's a lot to unwrap right there. There's just, first of all, my story is kind of similar. I fell into the group benefits business almost like ass backwards, right? You come out of school and like, what are you going to do? I don't know. Maybe I go work in a bank or something like that. Same strategy. But there's a lot of great stuff there. And, you know, and you've seen all aspects from an insurance side. Why don't you give an indication for those to say how much you think it's changed? Like talking about old school stuffing drug cards to where how we're trying to implement technology more and more into benefit plans today. maybe just kind of real high level, step one. I want to come back to some other things you talked about in a second, but maybe talk about from your aspect, where do you see, like, how much have you seen it transition, and you feel like, our organization's taking full advantage of all that's available out there today?
I mean, a lot has changed in the past 20 years. That's for sure.
Yeah.
I think that's expected. The service model has changed. The methods that we can use for communication, the methods that we can deliver a service offer or resources to membership as well as plan sponsors has changed. The evolution of the type of coverage has changed because the needs have changed from different people. There's, new demographics constantly in our business. And I think like every industry, every generation has a different priority of what's important to them. So we're seeing an evolution too in the type of product, the type of coverage that's being provided out there. And I will say, I think, and we'll probably get to this a little bit later, I think there's an increased focus now and a more conscious method of looking at benefit plans from plan sponsors, even on the smaller side of the business. I think 10 to 20 years ago, it was kind of perceived as, I have to have one. It's business expense, but we have to have a benefit plan. But I very clearly see now the need to provide more clarity on how we can deliver on meeting specific objectives that a plan sponsor might have based on the fact that they're a little more clear on what their plan members want.
Awesome. So given your background, as Rob said, you've been frontline, everything from service, even the plan member experience as a young child, seeing your parents go through this. So fast forward to today, you're very plugged in, grassroots. What do you see for that small to mid-sized business owner? What is important to them in the market for benefits these days?
Yeah, I think when we're talking about small and mid-size, and it's pretty similar even for the larger organizations, but it's very clear nowadays that benefit programs have a value for them. And like I was saying, it's more of a conscious approach. And I think some of the things that small and mid-sized employers are recognizing is that it's a very big part of the way that they can win that war for talent that exists right now. We all know it exists. I'm a hiring manager. I'm sure you are as well. So having a benefit program can help address that need when you're bringing on talent, but also in an effort to make sure that they stay. And I say that because I feel that the benefit program has become an extension of organizational health cultures, the culture that they want to put in place to make sure that we, as their plan members, their employees, actually know that my interests as an employee are top of mind for my employer. I'm not just there to be used, they're there to take care of me as well. And that benefit program is becoming part of it. I think the other thing that's become very relevant is there's a lot more data to support the fact that the benefit program can actually help my business. It can actually deliver a return on an investment. No one in this room is going to argue if I'm happy, healthy, and well, which I am, I'm going to be more productive than if I was struggling, dealing with specific issues. And that's the realization that I think is there, and that the health culture and that benefit program can help deliver. So there's that heightened sense of need from plan sponsors, and there's a heightened awareness of the value that they can actually get back from providing this in terms of productivity. And the last thing I'll say too is, we just went through an never seen before global pandemic, and it was all about health. So everyone was aware that there was a health issue in our country. Everyone was talking about, vaccination, drug coverage, which one, how do I get access to care? It was hard to go see your physician. And I just think it brought a heightened spotlight to the fact that we do individually have needs when it comes to health. So we're now just looking at what's available to us, both from our province, our government, but also from our plan sponsors a little bit more.
Great point. And we've talked about that as an industry, is that, what's going on with anxiety and burnout. Like, that's a new pandemic that's been going on in this country for the last several months, to say the least. And referencing back to data and trigger points, talk to us a little bit about what Beneva is able to do and provide to some of these small, mid-sized organizations when it comes to data. Because I think, the more organizations, and you hit it on with the small, mid-sized market, are looking for more data to make the right decision when it comes to proactively managing their plan in a lot of circumstances. You guys have done surveys and spent time, analyzing your data. Talk to us about what you're finding a little bit more.
Yeah, I'll talk to it from a couple perspectives. I think number one, a lot of times we're asked like, well, how do I know? How do I start? Where do I go? And that is very key. And I think what we're seeing nowadays is a lot of employers and plan sponsors, in collaboration with their advisors, are taking a moment to step back and understand, like, okay, what is my ultimate objective? Like, what is the culture that I want to have in my organization? And like I said, then building programs to support that culture. And a benefit program is part of that. And I think when they're looking at what that philosophy is or that persona that they want to adopt internally for their plan members, they're looking at things like what type of business do I have? Do I have a lot of physical laborers? Do I have people who are sitting at desks? What are the ages of my demographics? The locations of where they live, because access to healthcare in our country may not be equal in different areas. And then they're also using a lot of their own self-surveying tools. We don't have to, it's pretty easy nowadays to just use some online tools and get a pulse check on what's important for our plan members. So there's a lot of data that way when they're looking at what could we possibly do. And then I can very clearly see with the support of advisors now, they're then talking to the insurers about how can we address these clear objectives that we have determined coming out of this data. So that's, I think, a bit about the design aspect, Rob. But I think when we're coming back to the post-review, what kind of data can we give? There's a ton. There's a lot of data. And I'm still always surprised to see that while it's available, it's not heavily utilized. So, I mean, every insurer in the Canadian market is happy to provide, claims utilization reports on a specified frequency, probably quarterly for a small or mid-sized organization. And our account management teams are happy to discuss it. And it can look at things like, number one, just what is my claims in general, but we can look at breakdowns of where are the major conditions in our organization that we're having to treat from our benefits program. Are the drugs coming from a specific diagnosis or therapeutic class? Are there specific types of paramedical practitioners that are being more heavily utilized that might indicate maybe some issues around musculoskeletal challenges within our organization or mental health, like you said? And then with that data, we can do a lot with it. But I also think it's important, too, not to just look at what happened today or the last 3 months against at that same period the prior year. So you start getting a bit of a perspective on the trend. And you have a little bit more proactive ability to say, what are some of the emerging challenges that we might have? And then, again, with your advisor, start determining, okay, what's our action plan in collaboration as well with the insurer?
Yeah, right on. And for clarification, for those who aren't aware, organizations don't get information that Sunil claimed this and Rob claimed that. No, it's just high level, total corporate, spend. Where is it spending? And you're right. That's a great point. Looking at trending, because benefit plans have typically been reactive. I get my renewal, my rates are up. Do I have to look at, quote unquote, other quotes? Well, it's not exactly the situation that most organizations should start with. So great point there, Sunil. Gaps in coverage. That's where my brain suddenly starts thinking about then with all this information you're providing and what other organizations are not taking advantage of or what advisors should be providing back. Talk to us a little bit about some of the gaps you're seeing in today, because you're right. Like coming out of the pandemic, we saw a real heightened sea of things like telemedicine. Right? So maybe speak to us a little bit on that area, Sunil.
I think, okay, so the first one, I mentioned this in my personal familial story growing up, is everything we do in the benefits world is supplemental to our universal social assistance programs in this country. And I think right away there's a gap in understanding what is available to us as Canadians in our various provinces. And, I'll do a minor plug, a way for plan sponsors and advisors to make sure that we have clarity on that is we'll publish a legislative update every year, every province, showing all of the social assistance programs that are available, because it is very important when we're building our benefit plans to kind of collaborate and think about how we're integrating with those different programs that we get as Canadians. So I think there's a gap there, and I think there's also a gap in understanding how to access that coverage. I do think that there's confusion in our industry when we talk about benefits programs. We tend to talk about, especially like in the smaller mid-sized market, health and dental insurance. They're high utilization. Everyone touches them all the time. And sometimes we forget about the more catastrophic needs of coverage when we're talking about life insurance or, income replacement insurance for those hopefully never will happen day where I'm incapacitated to the ability that I can't actually earn an income. So I think there's a gap there in understanding that that's a need that we need to address, and how often we've seen someone come back to us and say, I didn't take the coverage because I didn't feel I needed it. And obviously there's a need and the coverage wasn't there. I also think that there's a very big gap in just understanding how to access and combine both my universal social assistance programs and all of the great tools given to me by plan sponsors. You asked me before about what's changed in the 20 years. We have mobile apps now where I can submit my claim and I can call my insurer. But then I have another app for my employee assistance provider and maybe another app for my virtual healthcare provider. And we've done this for so long. But if I take, something I talk to my team about constantly is, if you explain this to your spouse at home who is in a completely different industry, or your mom, or your friend, would they really understand what we're talking about and why it's valuable? And I think there's a very large gap in how we communicate what's available and also the way we're delivering it to our plan members who have been given such a comprehensive program, but there's so many places to go and see what they need.
I think that's so important because, and that speaks to benefits literacy, right?
Yes.
Like your typical person, oftentimes you learn the most when it's time for claim, right?
Yes.
And like, where do I go and how do I access it? So what are some of the points that you're seeing that Beneva is working on to help drive not only benefits literacy for plan sponsors, but plan members themselves?
For sure. We have a very conscious effort to simplify the language. So historically, some insurers tend to write a booklet from a contract. And it's two different purposes. One is to outline liabilities, between the parties involved. The other one is to explain to the actual end user how it works, what's available to them. So we've gone back to the drawing board ourselves, and I think this is a trend, just to make sure that the language that we're addressing our plan member is very clear. Let's get away from even saying plan member. Let's just say you, your family, you can. So we're trying to go back to that simplistic language. We're also trying to find ways to deliver information in a more strategic manner. So what I mean by that is, I don't want information when someone wants to tell it to me. I mean, we get information a lot. At home, I get told a bunch of things that I didn't ask for this information right now. So
what were you told this morning?
I don't care. Right. So we want information when we actually have a need for it. But, I'll take an example as an insurer. We've just launched this new service in our mobile app. Let's push it to everyone. There's a minimal value there. I think we have to be better at understanding how can we make that information available when that person actually has a need for it. So we're trying to find ways to make it available and easily accessible when it's needed. We're addressing the language, and we're also looking at the method of delivery. So how many emails do you get every day?
Too many.
Way too many. They're all from Rob. I guess so many from Rob.
You wish. But you're right on that, Sunil. It's like you think back in the day, as you said, you're stuffing envelopes with drug cards and we'd hand out booklets at employee meetings. How many people have opened a booklet?
Yeah.
Like it's not 1997 anymore. And people want information when they want it. And I remember back in the day when people say, I just want to give me a health and dental plan. What does that mean? It's like saying I'll build you a house. Well, what kind of rooms do you want? How many rooms do you want in it? How many bathrooms do you want? there's so much flexibility available today to small and mid-sized companies than ever before. So I love that approach because I think accessing that information is key. And that's definitely something I think is a great stepping stone that you're taking as a lead, is that instead of using words like co-insurance and duration and plan member, people are like, just change that, to modernize the language and simplify it. So when people need it, they know where to go. I think that's super. With all this information that we have, small and mid-sized companies, the more we talk to them, I would say in 2022, we chatted, before we went on air, was around, we saw it as a year that more organizations were adding to their benefits program than ever before. And we talked about a lot of BA, whether it was adding spending accounts or adding other flexible products, or companies, because of course we're looking to attract and retain their top talent. So then the next one, of course, is cost. You hear that all the time now. So it's cost sustainability. So the need to balance what they provide their staff and who pays for what. Maybe talk to us a little bit about, from your angle, what are you seeing from employers at Beneva around benefit design, benefit cost sharing? Maybe talk a little bit about that from a budgeting standpoint.
Yeah, I think this comes back to one of the gaps you were asking me about before. There's a big gap here about how do I manage that challenge? The challenge is not the gap. Everyone knows that it exists. Like, we have a real constraint. We can't just spend an infinite amount of dollars on these programs, but we want them to be strong. So there's a lot that we're seeing, and I think there's a lot that can be done by plan sponsors who are trying to face this challenge. So I'll go back to, making sure that we have that right review in place of that data that you were talking about, Rob, making sure we're doing it with that specified frequency, a quarterly basis, in conjunction with your advisor, to look at what's happening, also compare it against that prior year. Because with that information, we're going to get clear indicators of what might be the areas that we want to tackle proactively before we might get hit with a surprise increase or that's resulting from claims utilization. And so the options that exist around that are numerous. We can look at plan design options. Maybe we want to enhance the plan in certain areas to help proactively deal with certain conditions that we're seeing a bigger prevalence in our organization. Maybe we want to look at how we can integrate our plan a little better with our universal social assistance programs. Maybe we want to look at cost sharing when it comes to certain areas of our program. And when I say cost sharing, I'm not just talking about shifting a portion of the cost of the premium from an employer to an employee. I'm talking about maybe looking at ways to incentivize smart consumerism. Maybe, looking at a provincial average of a dispensing fee and maybe implementing a cap of that manner, or a per visit maximum that kind of is of a reasonable and customary nature for certain services in your contracts. So that's plan design options. I also think there's an opportunity to look at plan member education. Again, I'll speak to, there's a number of insurance carriers out there, us included, that on our mobile app, you have been written a prescription from your physician. There's functionality that can say, if you type in your postal code, these are the pharmacies around me, and here's the prices I can get that drug dispensed at. So I don't have to pick the one that's maybe the most expensive. Maybe I pick the one that's a little less expensive, and I help, both my plan sponsor maintain costs, but also I limit my own out-of-pocket costs. So there's education around what's available and how we can be good consumers as plan members. And I also think that there's an opportunity for us to look at the communication channels that we're talking about. Just to write, articles. We get asked from our plan sponsors, and we offer the support. Just educate. Can you help us explain to people why this benefit is important? Like, we had a specific plan sponsor ask us to write a memo or something that they could use to help address their younger demographic who really didn't understand why they needed to pay for their long-term disability insurance premiums. And that education, in collaboration with the communication stream, was a way that we could look at helping manage the costs as we go forward.
Yeah, great
point. I think when it comes to balancing cost with value, earlier we were talking about getting like the survey feedback that employers often do, like hearing from their plan members of what's important to them. So you just gave a great example there. I'm really curious, coming out of the pandemic, what were some of the feedback points that you're hearing from employers that their employees want? Some of those emerging trends of the types of benefits that they're looking for post-pandemic to manage their health.
It's shifted a little bit in the few years post-pandemic.
I can imagine.
I think originally there was a big push for virtual healthcare type of support because there was such an inability to get out and see someone. There was obviously a big demand for additional mental health support. I think we're seeing that slow a little bit. I think it's slowing for a couple reasons. I think many plan sponsors address that in collaboration with their advisors and their insurance carriers. There was a lot of support put forward, and I think there's just a heightened awareness now of what's out there. So we've seen a bit of a shift to other needs. And I think the biggest one I would say, Carolyne, is that demand for more personalized flexibility is clearly there. So the increasing prevalence of different spending accounts that can be utilized on kind of smaller mid-sized groups. We're even seeing in that mid-sized market a bigger trend towards some modular type of programs with different options where there might be a cost share involved for a more rich program for a plan member and their family. Those are some of the bigger ones I would see the trend on.
Yeah, and that's a very cost-effective way, right? Set budget, but flexibility to claim more or less in the areas that you need it. Like if you don't need glasses, then you can put it more towards,
Exactly.
Increased massage, for
Exactly.
example, having those spending accounts. What would you say, I want to dial in a little bit to the EAP programs.
Okay.
Because my perception is a lot of people, especially post-pandemic, think of it as, okay, my mental health resource. What else are employers seeing as trends? And you talk about education of the members. What is an EAP? Anything sticking out for you there?
Yeah, I think number one, when we talk about mental health, and I have to say this is not something I've been saying recently. I've been saying this for a very long time. The challenge with that subject is it is so huge. Like, you talk about my mental health. What are you talking about? Are you talking about maybe my inability to manage a substance? Are we talking about my lack of sleep? Are we talking about the financial pressures that I have on me? Are we talking about, maybe I'm going through a tough patch in my life? And the reality is an EAP program, an employee assistance program, has aspects that can address a lot of those different things. There's just a lack of awareness of the reality that does exist.
And I also think there's still a stigma around EAPs as well, right?
Yes.
The lack of proper utilization. That's one of the things I was shocked at coming out of the pandemic, that typically we would find if in Benefits Alliance, our average utilization, if we looked at all our EAPs, would be about 8-9% of an employer group would use an EAP.
Yeah.
I would have thought that would have been a lot higher, right? So coming back to that's a great point around lack of awareness, education.
Well, and
what can they use it for?
Well, and one of the things that I think can be really helpful in that specific area, but also just in the whole benefits program, is I work in group benefits at Beneva. We're a large organization, but we have, a lot of people who work in different channels of our business. They know nothing about their group benefits programs. They're a plan member and an employee that is offered this program. And when they have questions, the first person they ask, even though we have a full HR team and a full benefits team within that HR team, they ask their frontline manager. That's the first person they ask. And that person does not know. They're not as familiar with what these programs have. So I think there's a big trend in just getting your manager within your team to be not an expert, but just have them have some familiarity with the fact that an employee assistance program exists. There's tools there that can help you address maybe some of the financial pressures, like how to do a budget or do a will. There's tools there that can maybe help you look for support for like your elderly family members that you're struggling to take care of. And there's tools there for just, psychosocial counseling if you need that as well. But if you asked, I would say, throwing out a number, this is not a surveyed number, just my opinion, 85% of frontline managers wouldn't have a full understanding of what an EAP program is. And we are the first ones that our teammates will
And
ask.
that's so important because that
Yeah.
frontline manager is going to be the person that even observes the behavior of that person on their team,
Yeah.
right? You can see that they're struggling. There's something going on in their lives. They don't have to, get into the finer details of it, but they can spot that opportunity and hopefully direct them. So spending time educating further those frontline managers sounds like a well worth it in terms of investment of time and energy.
And here's an idea too for any carrier. You could switch your name around, because really an employee assistance program is an assistant for the employee.
Yeah.
Right? Is that whole guidance around the thought is that you don't necessarily have to be unwell to utilize an employee assistance program. As you said, like I moved to a new city, I maybe need new daycare, I don't know who's open. How do I want to talk to my mom or dad about assisted living, but they've lived in their house for 50 years. So I'm uncomfortable just coming up to them going, hey mom, I think it's time. So these are ways that they can almost be like a coach for employees in those time of needs as well, beyond just this. Obviously, as Caroline, if you adjusted around, if a manager recognizes that somebody's unwell. So it can be a tool too.
Yeah, that's a very valid point, because it doesn't have to be a reactive service. It can be a proactive service. And I'll remember, it's about 7-8 years ago, I had a teammate on my team, and she was struggling, and she was talking about, I don't have enough money and I'm really struggling. And I was like, do you have a budget? She's like, I don't know how to create a budget. And I just went online on our little tool, and I was like, there's a template. Just go home, try the template. She did it, so she found it useful. But again, it was a frontline manager she came to, and that was the first question. And for smaller, mid-sized businesses that might not have those full functioning HR teams, we can rely in collaboration with the advisors to work with your insurer. They'll be happy to help give some educational content to maybe some of those frontline managers. Again, let's not make them experts, but at least give them an awareness of what they can be saying to their employees if they get approached.
Yeah.
So if I'm a business today that does not have a benefits program, what would you say are the most top 3 emerging trends that Beneva, that you see that they should keep in mind as they're looking to design it, and then how they go about designing it?
A few of those key considerations are, again, to step back and think about what is the overall objective that we want this program to serve. I'm not a small business owner, but I can very well relate to the fact that it may be perceived as just a cost of doing business. We just have to have one, and that's okay. But at least you know what your objective is, and you can work with your advisor to develop that strategy. But if it is more than that, to say, well, we do want something that actually adds to the culture we're trying to personify for our employees, clearly understand what you want that objective to be, and then you can work with that advisor to develop a plan with a carrier that actually has the right services and tools that will help you meet that objective.
What are you hearing from plan sponsors as to the value they see in an advisor, helping them navigate through this?
They're an absolute necessity. As insurers, our job is to make sure that we deliver on the service expectations and the experience that we've promised. And we will keep you informed of everything that we're doing, some of the universal impacts that our Canadian healthcare system might have. But we're familiar with our offer and how our organization works. And I think the advisor has a very important role to play when understanding these are the needs of the plan sponsor and their members, and looking at which service offer from which carrier is going to help meet those needs the best. So they're an impartial resource that can help a plan sponsor really look at all of the options available in the Canadian insurance landscape.
There would have been well over 20 options at one point. You could have literally changed carriers every year and just kept going, but the game's changed, and you got 13, 14, 15 core providers. You have specialty providers, you have third-party administrators. We tell companies all the time, you have more options today than ever before, right? Yes. And I think it's good because that competition's good. It's allowing carriers to be progressive and stand out in the marketplace. And I think that's critical, why companies need a strong benefits advisor, someone who specializes in the marketplace, that understands that this is all we do is live and breathe benefits. I know it's not a sexy topic to a lot of people, but from our standpoint, say, yeah, they have more options than ever before, and we'll find the right provider that fits your needs when it comes to designing a program.
There's an increased need from plan sponsors for more than just a lowest cost. That's not the focus anymore. They understand a little bit more nowadays that the costs are going to be a direct result of the claims, and they're looking for a little bit more help in finding out, how do we manage that claim cost? And the advisor is very well aware of, Beneva's offering a biosimilar substitution strategy, or they have these tools that can help address, anxiety in your workplace, or you can work with, another leading carrier in Canada because they have this program that's directly going to meet the need that you have. And ultimately that helps that cost challenge that they have, but we can't expect our plan sponsor to have all of that information. That's not their job. So the ones tasked with it is...
You're bang on. And you know what? I would say companies will come to not just myself, but all our partners coast to coast and say, we don't want to be benefit experts, but we need you to guide us. What are the strategies that we can look at to implement some of these modern strategies that insurers are putting in place, how to communicate it, sustainability is a big one as well, right? Because where you're right, like the cost and cutting were the things 15 years ago. Not anymore. I think companies are more concerned now about what are some of the tools that I can help my team with, my staff with, to make sure that they have, as we touched on, like whether it's their physical well-being, their mental well-being, or their financial well-being, right? It's all those aspects that lead to better outcomes.
I'm glad you said that, Rob, because my perception has been in the past recent years that I think the business owners out there are tired of changing carriers and having that low cost expectation all the time, right? I think they're a little more savvy that, if you get that first year low price, that going into your next renewal, that it's probably going to be an increase. I'm feeling like that was happening out there, but what you're saying is validating that they're more interested in getting the right plan at a sustainable price than having that.
They're interested in the data. They're interested in the benchmarking. They want to know how they rank. And actually that made me think of a point, Sunil, is that, as you talk about providing tools to advisors for clients, one of the things that I think would be great to get is, what does your average client spend as a percentage of their payroll in benefits per year would be a great takeaway. So sometimes, my costs are up. Well, but you're only spending 3% of your benefit costs represent 3% of payroll.
Yeah,
it's very competitive.
Yeah,
but what is that number? And I'd love to see those type of benchmarking going forward from carriers as an idea. And you're right; they're looking for that type of guidance. Is what's the best way to design this moving forward? So.
Yeah, and maybe one quick comment. There's maybe a misconception sometimes, but I don't think it's a challenge. But there may be this misconception that there's an advisor in this mix, that there's another party. It's going to make it more expensive. But it's actually not the case at all. We mandate that our plan sponsors are working with an advisor because we need that party involved to help us, share the information transparently, give their own impartial, perspective on what that's saying about the group, where the trends are, where the challenges are. But we're not going to work. The truth is, we don't have our resources aren't set up to service plan sponsors in that manner, and that's another thing that we would say the advisor is very useful for.
Yeah, come back and there's more options with more providers, and looking at those unique strategies. I think you're bang on, Sunil. I like to joke too, depending what province you're in, that the provincial government, with the taxes that they charge, they make more money than we do. So what the hell are they doing for your benefits plan? So you're bang on with that.
Good. Well, today has been wonderful. I see we have touched all angles of this. We've got right from yourself at Beneva, the provider. We've gone through the advisor point of view, plan sponsor, plan member, the claims payer, the service, the sales, everything. I think we've really touched on the key trends of the small to mid-size and even larger business market. So thank you for joining us today, Sunil.
Thanks, pleasure. Appreciate it. Thank you for joining us today at the Benefits Alliance Voice. We hope you enjoyed today's episode. Please subscribe wherever you get your podcasts. And if you feel the episode was valuable to you, please feel free to share it with someone you think might benefit from hearing from benefit experts.